Hey guys, I'm Shannon, one of the physician assistants with Florida Plastic Surgery Group. Today I'm going to be going over discharge instructions for Dr. Fluco's migraine surgery. So in case you don't know, there's two different types of migraine surgery. There's a frontal migraine surgery and there's an occipital migraine surgery. I'll go over the instructions for wound care for both of them. So first I'll go over the frontal migraine surgery. After the surgery, I'm sure Dr. Fluco will tell you, but he's going to make an incision right on your eyelid. He's going to put stitches on the outside of the incision, and then we'll put steri strips on top of that. Leave those there. You can take a shower 24 hours after the surgery. Just don't put water directly on those incisions. So when you are taking a shower, just tilt your head back, let the water flow over your head. Being careful, trying not to get the water on those incisions. Don't take the steri strips off. You could actually pull on the suture and pull the suture out. If you see little pieces of the suture sticking out, just leave them there. When you see Dr. Fluco back in the office, he'll take those stitches out for you. As far as the occipital surgery goes, you'll have stitches on the outside of the incision as well. I'm sure he'll go over this too with you before the surgery, but we will have to shave a small strip of your hair right in the back of your head. And then we'll put stitches on the outside of the incision. We'll put antibiotic ointment over that. If you're a female, your hair, you'll usually come out with your hair in a ponytail just to keep the hair away from the incision. To take care of this, what we want you to do is a couple times a day get some antibiotic ointment, anything like Neosporin, bacitracin, a triple antibiotic ointment, any of them are fine, and put it on that incision a couple times a day. Same with the frontal migraine. You could take a shower 24 hours after the surgery. Just let water run right over everything. If you want to take a gentle shampoo, like a baby shampoo, you can, and just lightly rub around the incision. Don't scrub on the incision itself, but you can wash right around that incision. So when you get home, we do recommend you icing the area, whether you have the frontal migraine surgery or the occipital migraine surgery. I do recommend taking like a little cloth or a paper towel, putting it directly over the incision, and then putting ice on top of that. Don't ice for longer than 15 minutes every 2 hours. So I would set a little timer just to make sure that you're not going over that 15 minutes at a time. Like I said, for either surgery, you could take a shower the day after surgery, just let the water run right over it for the occipital, and for the frontal, try not to get your face wet. If you are a female or a male and you are going to blow dry your hair or use a curling iron or a straightener, I always tell people be extra careful because the area on your neck could be numb for a little bit. So just be super careful at first because we really don't want you to burn yourself. As far as medications go, we'll give you a list of medications after the surgery to help control your pain. We will go over with you with these medications before you do go into the surgery, and just make sure you know how to control your pain adequately. If you were taking a pain medicine specifically for your migraines before the surgery, you are fine to resume it after the surgery. For activities, Dr. Fluco doesn't want you doing anything that causes jerking movements with your head. So things specifically like driving where you have to look side to side, you want to avoid for at least 1 week. When you see Dr. Fluco back in the office at your 1 week visit, he will let you know when you can resume activities. You also want to do things that avoid you bending over, so things like tying your shoes, bending down to pick things up. You want to keep your head elevated, so try to exercise not doing any activities like that. Just in general, for healing, you don't want to do anything that raises your heart rate, so make sure that you're not doing too much strenuous activities. Like I said before, especially no jerking movements, but anything that could increase your heart rate. You want to make sure your heart rate stays low just while you are healing. So if you are doing activities, you start feeling like you're out of breath or you feel like your heart's really racing, you're probably doing too much. Just sit down and relax, and you want to make sure you're doing all these things for 1 week. Things to look out for after the surgery that you should call our office about include a fever, a high fever over 101 degrees, any shortness of breath, any swelling or pain in your legs, any pain that can't be controlled with the medicine that we give to you, any redness around the incisions, hot to touch, anything oozing or draining a significant amount. If one surgical site of the area is much larger than the other, so like increased swelling on one side compared to the other, please call our office right away if you do experience any of these symptoms. I think that it concludes my video for today. As always, if you guys have any questions that weren't listed in this video, you can always give us a call. We look forward to seeing you at your surgery.